What if I told you these disgusting worms save thousands of lives? Absolutely. And guess what? Hospitals still use them today. This might sound like science fiction, but maggot therapy is a real medical practice with centuries of history. Maggots aren't pests, they're precision surgeons. Today, we'll uncover the bizarre history of maggot medicine, exactly how they heal wounds 3 times faster than antibiotics, and why this disgusting treatment is making a major comeback in 2025. And yes, I'll show you exactly how they're used today. Let's dive in. Before modern medicine, indigenous tribes in Australia and Myanmar intentionally used maggots to clean wounds. But Western doctors? They called it barbaric, until war forced them to reconsider. In 1812, Napoleon's chief surgeon Dominique Jean Larrey documented something bizarre. Soldiers left on battlefields with maggot-infested wounds had higher survival rates, but his reports were laughed at by proper doctors. After more than a century of denial, in 1917, American orthopedic surgeon William S. Baer was treating soldiers in France when he noticed 2 patients with identical leg wounds. One was treated properly with antiseptics, the other abandoned in no man's land, his wounds crawling with maggots. When Baer finally examined the neglected soldier, his wound was pink, clean, and healing, while the proper patient died of gangrene. That moment changed medical history forever. By the 1920s, maggot therapy was standard in more than 800 hospitals in USA. They even sold sterile maggot kits. But then, Alexander Fleming discovered penicillin. Yes, antibiotics arrived. Maggots were labeled primitive and forgotten. Today, this Stone Age medicine is FDA approved and more advanced than ever. But how do modern maggots work? Let's geek out on the science. Maggots don't just eat dead tissue. They liquefy it with a cocktail of 6 genius enzymes. Think of them as nature's tiny chemists. Number 1. Urea. Softens dead cells like dish soap on grease. Oh my god, what an example. Number 2. Allantoin. Stimulates new tissue growth. This chemist used in modern skin care. Number 3. Licofensin. A peptide sniper that only kills harmful bacteria. Even MRSA. Their spit is so precise, it leaves healthy tissue completely untouched. Unlike human surgeons who sometimes cut too deep. Why use maggots when we have drugs? Because superbugs like MRSA build biofilms, a slimy shield that antibiotics can't penetrate. But maggots? They dissolve biofilms with phenylacetic acid that breaks bacterial communication networks, and valeric acid melts biofilm glue like hot water on ice. In 2023, Johns Hopkins study proved maggot-treated wounds had 92% less bacteria than antibiotic-treated ones. Of course, this is the power of maggots. You think getting eaten alive hurts, right? Nope. Maggot secrete has natural anesthetics that can block pain signals. And these secretions are pH buffers. They keep wounds slightly alkaline. Nerve endings which transfer sense of pain hate that. Patients report less pain than with standard dressings. Just a weird tickling sensation. Today's medical maggots aren't scooped from trash cans. They're lab-grown and FDA-approved insectaries under stricter conditions than most hospitals. Just like sterilization, health workers apply 50 or 100 larvae per square inch. They work best at body temperature like little metabolic engines. A diabetic man with a 3-year non-healing ulcer. After 12 failed treatments, his doctor suggested amputation until they tried maggots. He said, "It felt like pop rocks on my skin." In 2 weeks, my wound was 80% smaller. Probably you ask yourself, how do they control hundreds of hungry maggots? They're using modern protocol. First, hydrogel barriers keeps them only on dead tissue. Then, 48-hour limit prevents overeating. Absolutely, that's a real risk. And last protocol is UV inspection. Nurses check progress under black light. From Germany's maggot therapy centers to VA hospitals in the USA, this treatment is booming. In 1829, French surgeon Dr. Guillaume Dupuytren ignited a macabre trend across Europe. His maggot miracle cases led to reckless experiments. Wealthy Victorians paid to have larvae sewn into their faces to treat acne, while cholera victims were dumped in maggot pits to purge their infections. Then came Dr. William Bayer's infamous experiment in 1921. He left maggots in a soldier's leg wound for 14 days, far beyond their 72-hour safe window. Can you imagine the result? The larvae ran out of dead tissue and began secreting proteolytic enzymes into living muscle. The patient died screaming as maggots reached his femoral artery. After Bayer's disaster, maggot therapy was banned in 37 USA states. When antibiotics hit, journals called it medieval quackery. By 1955, only one hospital still used it, a leprosy colony in Louisiana. But Dr. Ronald Sherman kept the faith, collecting maggot success stories in secret, until superbugs forced medicine to re-embrace the grotesque in the 1990s. Today, we've learned from these horrors. Strict protocols, prevent overuse, and gene-edited maggots may soon make tragedies like Bayer's impossible. But that begs the question, how far should we push nature's darkest healers? That's a debate for the comments section. Right now, labs worldwide are turning these wriggling surgeons into living medical devices. Here's where the science is headed. You know what's the dream? Maggot nanobots. DARPA-funded research aims to shrink larvae to microscopic size for brain tumor access, or load them with cancer-killing drugs, and control movements via magnetic fields. So, would you try maggot therapy? If you learned something wild today, smash that like and subscribe for next week's video on MedShock TV. I'm very eager to hear your thoughts on this video. If you have any suggestions, let me know in the comments. Catch you in the next one. Stay curious.